All right, well, we'll go ahead and get started. Welcome, everyone. My name is Ryan Campbell. I'm the chairman of the Board of Supervisors for Tuolumne County. I'm here with Dory Beets. She's our OES coordinator. Also, we have Dr. Sargento. He's our public health officer for Tuolumne County. Michelle Jaquetta, who is the public health director. We also have Christina Herrera, who will be helping to answer some of your healthcare and COVID-19 related questions on the chat, the live Q&A. Also with us is Dr. Hurd, who's with the Adventist Hospital here in Sonora. Cole Presbola is going to be joining us. He's the director of the Innovation and Business Assistance Department for Tuolumne County. And so we've been in meetings all day. It's funny, it's with this group of folks right here, we've been in and out of meetings together all day long. And most of it is, there's a fair amount of good news, actually, I think. And we've had a pretty good response rate to our vaccinations in Tuolumne County. And we're still working toward getting to the yellow tier. We're in orange right now. So I'm going to turn it over to Dory. Do you want to go ahead and go over kind of some of the things we're going to talk about today?
Yeah, thank you, Supervisor. Just to remind everyone that if you have a question, please put it in the chat box. We have several of us that are monitoring those questions, and we can respond to those live as they come in. So please don't be shy in asking us those questions. We are recording this, and this will be loaded up onto the Office of Emergency Services website under COVID-19 updates for future reference. So you can go back and listen as well. So thank you again for joining us. And we hope we're able to answer some questions with the panel group that we have.
So, Dr. Sargento, do you want to start us off with kind of an overview of where we stand in Tuolumne County with respect to COVID-19 or vaccinations, testing, and all that good stuff?
Yeah, so we are doing well. We're solidly in the orange tier of the 4-tier system, known as the blueprint, and our case rate is around 2.5 cases per 100,000, which is the low end of the orange tier, but not quite enough to get us into the yellow tier, but we hope to be able to do that over the next month or so. Our testing positivity solidly within the yellow tier. We've never been really worried about that except during the surge over December and into January. Today it's at 1.6%. So those metrics looking really good. And continuing that trend. Vaccine uptake, again, about 40% of our population has had at least one dose of the vaccine. And we're continuing to offer that vaccine. Both Adventist and Public Health is doing that. Statewide, we're also continuing to see that trend of decreasing cases and as a result, decreasing hospitalizations, probably the best we've seen for COVID hospitalizations since the start of the pandemic. So really good news in that respect. Though, sort of the cautionary tale is that we were just coming back from spring break, and we have seen in the East Coast states, New England, Michigan, Minnesota, and even now starting to see in Oregon and Washington sort of an uptick in cases there. So we're hoping that our vaccine administration will keep us out of that increased cases that we're seeing in other states. So other good news, there are new guidance out as of Friday, specifically around gatherings, and these all go into effect on the 15th. So in terms of getting people together, family groups, other things like that, we used to talk about no more than 3 families. Now for the orange tier, we're talking about groups up to the size of 50. And then for if we get into the yellow tier, or when we get into the yellow tier, groups up to the size of 100. And then we're also looking at things like wedding receptions, what are called private events, and the guidance associated with them. So those will come into play. And I'll just briefly mention for like an orange tier wedding, you could have up to 100 guests. So I think that's a doable thing. And then there's going to be also guidance on indoor live events or seated performances. And so again, kind of moving back into theater and things like that. So that's all really good news. And I think it's probably the biggest thing to talk about in terms of moving forward is the Beyond the Blueprint strategy that was announced by the governor yesterday. And what I would emphasize is that even though the governor mentioned a date, there are two conditions that need to exist before we can actually move into that Beyond the Blueprint. The first being that everyone who wants a vaccine has the availability of getting a vaccine, and that includes our 16 and 17-year-olds. That requires access to what's called the Pfizer vaccine. That's the one vaccine of the three that are available to us that are approved for use in the 16 and 17-year-olds. And then the other thing is we have to have adequate healthcare resources. And so making sure that we're not in surge like what's being experienced in Michigan right now. So again, have to be mindful of that, have to continue doing testing. And I think the important thing is that even if we meet those two conditions, and we proceed into this Beyond the Blueprint, is that we still have to do those things that are the individual actions that reduce disease transmission. So wearing your mask, washing your hands, watching your distance, not necessarily from people you know, but from people that you don't know their vaccine status, you don't know them well enough to know what their health conditions are. So out in public, basically. And then something I was mentioning to Supervisor Campbell earlier today is I hope a lesson we've learned from this pandemic is that if you're sick, stay at home. Something we didn't used to do as well, and hopefully we will do better in the future. And then I will say that a vaccine has been an effective means of mitigating the impacts of the disease. We've seen how it's impacted transmission in California already. So I'd encourage people that if you're eligible for a vaccine, get the vaccine. And I'll pause there and see if Shelley or Dr. Hurd have anything else they'd like to add.
Oh no, that was a great overview. I don't think I have anything else to add other than, also important this week is that we're moving completely transitioning to my turn. So as of tomorrow, we'll be turning off our online vaccine inquiry form and just directing folks to go to my turn. In fact, our next first dose clinic on April 22nd is already live on my turn, and people can make appointments now. However, until April 15th, only appointments will be available for those 50 and older, and in those 16 to 64 with those underlying health conditions, and in the identified sectors. So because my turn hasn't quite caught up to that, and we'll not be opening that wide open until April 15th. At that point, then anybody can make an appointment in my turn. But any questions about that can be directed to our call center or our email.
And then again, my turn is the central statewide vaccine sign up, and it's myturn.ca.gov. So pretty easy to remember. And again, we're transitioning the county from our homegrown registry to the statewide registry, and that's again myturn.ca.gov. Dr. Hurd, anything else from your end? And you're muted. Yeah, you're still muted.
You're still muted, Dr. Hurd.
Is that better?
There you go.
All right. People at the hospital will be teasing me about that for days. But the good news in the hospital continues. We just discharged our last COVID positive patient. So the hospital is COVID free at this point.
All right. And then just looking at the question in the chat, will guests need to show proof of vaccination? No, they won't, but I will say that if you want to have larger groups under the guidance for the private events, if you have a fully vaccinated guest list, then you can actually increase the number of guests that you have going to your event.
Yeah, I'm looking at it. It's for the orange tier, maximum of 100 people. But if all guests are tested or show proof of full vaccination, will be a max of 300. That's outdoors. And then indoors is only if guests are all tested or show proof of full vaccination, a max of 150. So, yeah.
All right. I think that's it for updates unless people have questions.
I do have one more update in that the transition into the orange tier has allowed the hospital to expand its visitation policy. So now admitted folks will be able to have 2 visitors at a time. I think we're starting that on Monday.
Right, and I was going to say mass vax clinics this weekend, or this year, Adventist is having a clinic this weekend?
We're having one Friday.
Friday, and that's the first of the Friday ones. And, all right.
Yeah, well, we don't have as many questions this time as we did in the past. One thing that I could add is that we are talking about what the pathway is forward for opening public meetings to the public again. And so the hope is that when we get into the yellow tier or possibly sooner, we'll be able to open, for example, the Board of Supervisors meeting in a limited way for the public to actually be there to interact. Dr. Surjenko, are other counties and municipalities opening up? Do you see that happening more throughout the state?
Yeah, I think that's that we are seeing is that as we move out of, when we're in the purple tier, county buildings, county offices needed to be closed. So, and we progressed to the red tier. We talked about when would be ready. Now that we're solidly in the orange tier, we're seeing other county governments open. As an example, we talked to Madeira today. They've been open. Here, where I normally have my day job in Mariposa, because our case rates have been lower than other surrounding areas, we've been pretty much open. So I think the idea would be is as we have board meetings, planning commission meetings, things like that, it's important to maintain social distancing. So figuring out the capacity of a room that aligns with that particular tier, whether it's a 25, 50, or 75% attendance allowed based on the building capacity, and then setting up your seating space for that. That will allow for more people to attend. That said, it seems like most meetings that are being held in a hybrid fashion, so that if people are concerned about disease transmission in a meeting, that we offer them a Zoom or a GoTo or a WebEx so they can contribute their thoughts to a meeting, but do so remotely if that is a concern they have.
And Doctor, we just got a question that I'm pretty sure you'd want to answer. Can you explain the June date that the governor announced this week, and what does that mean?
Yeah, so let's, and I did talk about that, what's called the Beyond the Blueprint, and the governor mentioned the 15th of June as being the date when that would happen. And I would characterize that as the date that will most likely happen, because if, again, those two conditions are met, the adequacy of availability of vaccines, and we're not in a healthcare surge, then we can move forward that. And so I think, you know, most likely, highly probable event that will happen. What will happen is that, again, all of the sector guidances will be lifted. So when we talk about what you can do in the yellow tier with a live event, what you can do with retail outlets, what you can do with campgrounds, all that stuff will go away. And it really gets back to personal responsibility and doing those things that we know reduce disease transmission. We would ask people to continue to wear a mask. And this question has come up before, is do I need to continue to wear a mask if I'm vaccinated? And the answer is yes, because it's kind of like wearing a seatbelt, but also knowing that your car is engineered to take a car crash. You want to maximize your redundancies. We know that vaccines work about 90% of the time, so you wear the mask to protect you against the other 10% of the time. So wearing a mask, watching your distance, again, same thing. The more things you layer on to prevent disease transmission. And then I think I've already mentioned staying at home when you're sick. So those are the personal actions that will still need to be in place along with getting a vaccination. But all those business guidances, all those sector guidances will go away. And again, June 15th, if we have enough vaccines out there and if we're not in healthcare surge.
Okay, and I think you answered just the last question that just came in with that last comment that you had, which was how long will we be wearing masks?
Yeah, I think, you know, again, until we see the disease transmission drop to a safe level after we've gone into this beyond the blueprint, because again, even though there's science supporting this move, that is, we've got vaccines and we're seeing decreased transmission, when we lift all of those restrictions, we know that we're going to see more cases. We just don't know how many more cases we're going to see. And so that mask acts as a means of mitigating transmission. And then once we see where that settles, then we may see masks going away. But again, I would encourage everyone, at least for the next, let's say at least through July, to expect to be wearing a mask when you're out in public.
There's a question in the chat about benefits of getting vaccinated if you've had COVID.
Okay, I'm not seeing that. There we go. Let's see.
So, well, that's a good question. I mean, that's one of the things that I've read about it are people that have had severe symptoms as a result of becoming ill from COVID-19. They take the vaccine and it alleviates some of those long-term symptoms that they're suffering from.
Right.
Have
so
you
yeah,
seen that taking place?
Yeah, we've heard of that from people we have vaccinated, and you know, there's a lot of anecdote that is people saying, "Hey, I had COVID long haul symptoms, and I got my vaccine, and now I feel better." So that's one of the benefits. The other benefit is that we do know that the immune response produced by a vaccine is in some ways better than that produced by a natural infection. So you know, again, getting back to how many layers of protection can you add, that adds another layer of protection, both for you and for the community, because every time someone doesn't get COVID, they're not going to spread it, and they're not going to spread it through the community. So you're doing yourself a favor, you're also helping out the community should you get exposed to someone who's infected.
Okay, we had a question, how are the incoming vaccines coming in to just the county or other providers, and how is public health and Adventist Healthcare working together? I can answer that last question extremely well. It's been, I think we've improved the relationship between county public health and our local hospital, Adventist Health, extremely well. it's been good to see, and I think as evidenced by we have our public health officer and Dr. Hurd from Adventist on just about every one of these calls that we have. So I think we're partners in this, and I don't know, Dr. Hurd, could you answer the question about how do the vaccines come in? Do they come to you directly? Do they go? How are they distributed within the county?
So it's a great question, and it's in flux almost daily. But Adventist Health, as a multi-county entity, applies for an allocation for vaccine, as well as the county getting their own allocation of vaccine. And you request what you think you're going to use, and then they send you what they're going to send you. So within the county, we're doing a pretty good job sharing back and forth with the county public health, and really trying to design the system so that the people who need a certain type of vaccine for a second dose can get it, so that the folks who are medically complicated can come and get it in a place that has in the hospital with clinicians available and a sort of higher level of safety and observation. So it really is it's coming in multiple different ways, and we're sharing it out to maximize the utility.
Yeah, I would definitely echo that, is that we have shifted vaccine doses back and forth as needed to meet the needs of our clinics. And then, it's not just Adventist that's getting vaccines, but the store pharmacies are now ordering directly through MyTurn. And then since the vaccines have been distributed, the Miwok and Matheson clinics have been getting a direct allocation from the Indian Health Service. And so we've been able to track that with them as well. So multiple ways of getting vaccines. And then the other one that we really don't have as good a handle on is what's called the Federal Pharmacy Partnership. And that's where the federal government is sending doses directly to CVS and Rite Aid. And we have less visibility on that, but are working with those retail outlets to know what they have on stock and trying to share that as in the best timely fashion that we can.
Okay, so I think we're out of questions.
Got a new one.
Okay.
So how about variants? Have we seen any in Tuolumne County? And the answer is not yet. We have sent some off for sequencing, but what I will let people know is that the turnaround time for sequencing really is about 20 to 30 days. The state is sequencing about 6 to 8% of all samples that are done in the state. So that's taking time, has created a backlog. But we did have several cases that were of concern that we sent off for sequencing. And we anticipate the results of those probably in the next week. I would not be surprised if some of those samples we sent off turned out to be the variants. We know that the B117 variant, which is the United Kingdom variant, has been identified in cases in Stanislaus County as well as in Madera and Fresno County. And so it may be that these cases that we sent off could be the B117. Just don't know that yet. We do know that that particular variant is about 60% more effective in spreading and is about 55% more likely in resulting in hospitalization. So that's what we know about the variants in our region.
Yeah.
Okay.
And then the next question is, when are we going into the yellow tier, which is, that's a very good question.
Yeah, so we need to
have
have
a crystal ball, doctor.
I don't. I know that we need to have a case rate of 2 cases per 100,000. That's a daily average. So it really translates to about 7 cases in a week. And we're really close to reaching that. Our case rate for the last week was 2.4 cases per 100,000. And then we need a test positivity percentage of 2% or less, and we've been consistently below that.
Open another one for
Yep.
private events.
I'm going to say yes. I just have, again, we have not actually seen the specific guidance on this yet. So the press release that I think that Christina put into the chat box is the extent of the information we have at this point. So we're awaiting those more detailed instructions, the same as you are.
I think.
Okay, so we're gonna, I guess we'll see if there's any closing thoughts among you, Michelle, Dr. Hurd, Dr. Surjenko. And if we don't get any more questions in that time, I think we'll go ahead and close the town hall and thank everyone for being a part of it. Dr. Surjenko, any final thoughts?
No, just again, do all those things that we talk about, do them on a regular basis. Don't give up on masks yet. Vaccinate when you can.
All right. Michelle?
No, I think Dr. Surjenko said what I was going to say. Just, you know, it's, there's hope, and just cautious hope, and continue to be patient. And as we enter this new season of updated guidance and all that, and continue doing all those things that help us get there.
Dr. Hurd?
I ditto. Is that a possible answer? No, I think one of the best parts about doing one of the mass vaccination clinics is I ask folks what they're going to do with their newfound immunity, and you know, the answers range from, you know, going to see my grandkids, to traveling, to having a family reunion, to just going about my life and doing it with, as Michelle says, a little more hope, a little more optimism. And it's a wonderful thing to see from the public.
All right, well, thank you very much, everyone that participated in this. Dr. Hurd, Michelle with Public Health, Dr. Surjenko with Tuolumne County, who's our Tuolumne County Public Health Care Officer, Dory Beets, who is with Tuolumne County Office of Emergency Services. I'm Ryan Campbell. I'm the chairman of the Board of Supervisors for Tuolumne County. We'll have our next town hall on May
5th.
5th.
Mm-hmm.
I have to check the calendar. So we'll have our next town hall on May 5th at 6 o'clock. You're welcome to join us, and please, those watching at home, let all your friends know if you have any questions. We'd be happy to answer those questions. So right at 6:30, we're going to go ahead and close the town hall. Thank you very much, everyone.